Hi, my name is Skylar Page. Today we're diving into the concept of medical colonialism and exploitation in clinical trials. We'll explore this through the lens of the Puerto Rico pill trials, a significant yet controversial chapter in medical history. Medical colonialism refers to the practice of using marginalized groups, often from colonized or developing regions, as subjects for medical research without proper ethical considerations. This often intersects with issues of gender, race, and socioeconomic status, leading to severe ethical violations like the lack of informed consent and unfair treatment. The Puerto Rico pill trials were conducted in the 1950s to test the safety and efficacy of the first oral contraceptive pill. With birth control options limited and a dense population, Puerto Rico was seen as an ideal location for these trials. Local officials supported birth control to manage the island's endemic poverty. Researchers selected poor, uneducated women, often from marginalized communities, to participate in these medical trials. These women were chosen because the researchers believed that if they could follow the regimen, then women anywhere in the world could do the same. The selection process was not random but rather targeted, focusing on those who had limited access to education and healthcare. The researchers assumed that these women, despite their lack of formal education, would be able to adhere to the strict medical regimen prescribed to them. However, this approach overlooked the unique challenges faced by these women, including their limited understanding of medical procedures and potential risks. These women were not fully informed about the experimental nature of the trials or the risks involved. In many cases, they were not given adequate information about the potential side effects or the fact that the medication was still in the experimental phase. This lack of informed consent raised significant ethical concerns. High doses of Enovid were used in these trials, far exceeding the amounts typically prescribed. The rationale behind using such high doses was to test the limits of the medication's effectiveness and to observe any potential side effects. However, this approach was fraught with danger, resulting in severe side effects like nausea, dizziness, and even death. The high doses led to a range of adverse reactions, some of which were life-threatening. Participants reported experiencing extreme discomfort, and in some tragic cases, the side effects proved fatal, which were not properly investigated. The complications that arose during the trials were often dismissed or inadequately addressed. This lack of thorough investigation into the side effects and overall impact of the medication on the participants further underscored the ethical issues surrounding the trials. The trials raised significant ethical issues, including the lack of informed consent and the exploitation of vulnerable populations. This reflects a broader pattern of medical exploitation and has long-term implications for trust in medical institutions among marginalized communities. Today, such trials would not meet ethical standards like the Declaration of Helsinki, which emphasizes the need for informed consent and protection of participants. However, unethical trials still occur, particularly in developing countries. It's crucial to uphold stringent ethical standards globally to protect vulnerable populations. In summary, the Puerto Rico pill trials exemplify medical colonialism and exploitation in clinical research. By remembering these past injustices, we can work to prevent their recurrence and ensure ethical practices in medical research.